abnormalities. Basically displaced teeth, wolf teeth, anything like that. Decay, which, posh word, is caries. That has different levels of decay, a bit like a human tooth. We all go through it, there's no such thing as like a Hollywood smile. Horses don't have perfect mouths, we just have to adapt them and shape them, basically to make it as comfortable as possible for them, so they can work basically correctly for us, grind the feed better, which in turn helps keep the weight on properly. A lot of you might not be familiar with like the power tools, which have moved on like massively now. People think, oh, it takes loads off, it does this, it does that. If you're trained correctly with it, it's far better to use a power tool because you can be more precise. You can actually pick the bits that are overgrown and just basically reduce that part of the tooth. If you're hand rasping, you're pulling backwards and forwards, so you're taking it off areas that don't necessarily need it as well as the areas that you do. Yeah? These discs, think of it like a giant nail file, yeah, that goes like circular. I'll show you later, they cannot cut soft tissue. I can put that on my arm when it's running and it will not cut you. Yeah? So even if the horse is a bit fractious and moving about, with the hand rasping it's so easy, you're rasping away, it moves, you pull back, you can catch the side of the mouth, you can catch the palate, you can catch the tongue. People say, oh, if they're having the horse's teeth done, it's bleeding. It shouldn't bleed, do you know what I mean? Unless you're taking something out, the mouth shouldn't bleed. This, if they're moving around, you know it's not going to catch the soft tissue. So that's one of the benefits of pretty much using this stuff. Okay, this isn't cheap, these bits and pieces. Each one of these hand pieces is 1,200 quid. Right? So not everybody can afford to actually buy this stuff, yeah? That's why a lot of people will buy the hand rasp. If you buy one of these, you probably get for a good one, 80 quid. Yeah? And all these little inserts in here, they're like sections, and you can turn them so you've got 3 sides to be able to use. So it's not like, oh, when that's blunt, you have to buy no, and you can just rotate it and rotate it. So there's quite a lot of longevity using that. Again, you need a different range so you can change the angle. This bit moves around, so you can get up and around the back of the teeth, yeah? Down the sides, and then on the bottom all the way. So one bit can do quite a lot of stuff. This is like the finishing off one. So when you've took all the sharp edges off, if you just want to round it a little bit, and then you can shape. Usually you shape the first teeth at the top and the bottom with a bit of comfort. What we used to do was take quite a lot of the tooth down. It used to be called bit seating, yeah, but that's a bit obsolete, the term now. What you do is profile it, so you basically just take that right angle off so the bit sits comfortably. It's basically to stop any skin pinching between the point of the tooth on the first one and the soft tissue, so the bit can't catch as well. They use it for like dressage horses, polo ponies and stuff like that as well. For other bits, for like wolf teeth extraction, again there's a range of different things. Different people do it different ways. It should always be done under sedation anyway, and the only person that can sedate intravenously is a vet. So whether you choose to have your vet do it or the vet come out and sedate and then your dentist, that's up to you. But basically all you basically do is go around the tooth, the tooth that's exposed, you move all the skin from away from the tooth, yeah, carefully without stabbing it. So you make it so it's like an apple core. So you can see if you're doing like an apple core, that tooth will become looser and looser, yeah. And you use like a little pair of forceps to gently take it out so you don't snap it. It's not as bad as it looks, yeah, and it shouldn't be gushing with blood or anything like that, not unless you've got the artery. There is an artery that runs on the inside edge, hence why they are sedated. It's a painful procedure, it can be, yeah, so get your vets on board to do it. To actually open the mouth, you know it as a gag, it's a speculum. There's different sizes, different types. Basically it goes over the head like a bridle. Upper jaw sits on the top plates and there. And it's a ratchet system. This one's nice and easy because if you've got a horse that's got quite a stiff jaw or it's old but can't open its jaw for one side, got an abscess or something like that, you're not forcing it and pulling it, so you can't, doesn't have to be exactly the same on both sides. That one is a pony one. Yeah, the same sort of thing. It sits on the plates, but this one clicks open. It's a bit more rigid. There is another one for working on the incisors, which you probably haven't seen. You don't often have to do any work on the incisors, but if you've got one missing and the opposite one's grown into the space, it stops the jaw moving laterally, because if you move the jaw, it'll clunk. Yeah, it can't move it. This basically goes around the top of the ears, and this bit slides into the mouth between the two sets of molars. So your top molar and the bottom molar, so you've actually got space then between the incisors, so you can work comfortably with that. But you really need to use it when it's sedated as well, because the incisors are a lot more sensitive. They're a lot longer, so the vibration is a little bit more. The actual battery pack that we use, it's moved on. It used to be like the cables and leads everywhere, but now with all the health and safety thing, they like you to use like a battery pack. This one, the handpiece, is basically with an extension. We'll click in, screw that in. Basically off again. I can put that on the arm. Just feels strange, the vibration, yeah? Can't hurt, yeah? That's right, from a safety point of view. It's quite nice for them. These aren't cheap though. I think the handpieces are expensive. There's two versions of this. This is like the lightweight one, which is just over £2,000.
Is that the one like a backpack? Yeah, it's another way to...
Pretty much, yeah. Put it on. Some people don't have the, but if you're doing a lot of horses each day, yeah, it takes the weight off your back and your shoulders.
Yeah, that's...
You can move around, there's no hassle. If you want to stop what you're doing, you can slide your hand pieces down and then still move around with your arms, yeah. Last thing you want is moving around and the horse catches its tail in the cable or something and then kicks out, yeah. So it's worth its weight, makes the damn sight easier, health, safety, do you know what I mean? You can move around the horse, you can let the horse move around you. You don't have to want it to keep still because you want to worry about cables and everything. So you need a decent light. Again. These ones are really quite bright, so you can actually see what you're doing. Have a good look. Again, that's about 360 quid. There is cheaper ones. That one's probably about 250. That's like a backup one. There's headstand for if you've got sedation work, so you're not asking somebody basically to sit it on the shoulder. That's like adjustable. Sheets, each to their own, but I use like carbon one. They only gets a top copy. I keep the bottom copy for reference, and if it needs to get sent for referrals and the owner can't find the sheet, because oh, it was in my passport, I've lost it, I don't know where it is, so I always keep a copy. A lot of insurance companies now are asking for 2 years worth of dental history when you're doing a referral, if it's a big extraction or something like that. They don't want you to think, oh, we've just insured it so we can have a tooth taken out, because that's about between 1,500 and £2 to take a tooth out. So it can be quite expensive. The cleaner and disinfectant you should use for all your equipment, basically 1 to 2,000. That's the ratio to use. We use buckets now, so it's probably 5 ml, which is basically one pump, one in a 10 to 15 litre bucket. This is Horace, apparently. Paul Horace. And you've done a bit on ageing, haven't you? The ageing of the horses. Teeth-wise, they're generally born with maybe 2 central incisors, yeah, at the bottom. By the time they're a year old, they'll have all the baby teeth on the incisors. And by the time they're a yearling, these are deciduous, means they get replaced, yeah. At the same time as these are all forming, the second, third, and like fourth, third and fourth tooth here, these ones will also be forming. This first, second and third tooth on both sides are all baby teeth when they're first born, yeah. They'll get replaced as well at different ages. I'll go through that in a minute. And then this is a permanent one that doesn't get replaced, and the 10 and the 11 there, they don't get replaced. Okay? They're all numbered, starting in a clockwise, so your upper left, so your upper offside. All these teeth, so it's looking at Horace. That's all your one arcade. Each tooth has got a number. So you start from the central here, which is, he's lost his one. So that's 1, 1, 1, 2, 1, 3. Got a little canine there, so that's your number 4 tooth. If you had a wolf tooth, that would be your number 5. And then 6, 7, 8, 9, 10, and 11. Upper near side is your 2 arcade, so again, that's all numbered. So it's 2, 1, 2, 2, 2, 3, 2, 4, 2, 5 if it's a wolf tooth, and all the way back. The bottom one, this is the 3 arcade. There's some nice fractures on there. And that's the 4 arcade. You start losing the teeth at 2 to 2.5, and they go in a pattern. So if you've got a young baby horse, these central ones will go first, like your rabbit teeth if you like, and it goes 2 top ones at the top, and then the 2 top ones at the bottom. That's between 2 and 2.5. At the same time that's happening, this number 6 tooth, yeah, that gets replaced as well on the top, roughly at the same time. When the 2 bottom ones get replaced here, those generally go as well. Then you've got the 7 and the 8, they get replaced at the same time, that one, and there, and then the outside ones. So by the time they're about 4 to 4.5, they've basically nearly got a full mouth of permanent teeth. If they had absolutely everything, if they had 4 canines and 4 wolf teeth, there'd be 44 teeth. Yeah, mares generally don't have canines, they can have like little residual ones, but they haven't got much use. They're basically for fighting and holding on when they're entire and they're covering. So if you have 4 wolf teeth as well, not everything, you can have 1, you can have none. It's a bit like people with big teeth at the back, wisdom teeth. Think of it like that, but at the front. Basically, we take them out because they're not fused to the jawbone. They actually like sit loose in the gum, and they can move about. So if you're riding, doesn't matter how good your hands are, if you're on a young horse, the horse is trying to balance itself as well as the weight of the rider. So you won't be able to keep your hands still, and the bit will lift and bang on the wolf teeth. So it's usually say before, when we first check a horse, if it's got any, just get rid of them, because at some point they're going to cause hassle. And they might not cause hassle first of all, but if you want to start jumping, dressage, eventing, whatever you want to do, and you want to actually ride with a contact, it's going to hit that wolf tooth. Basically it stems back from the training. They didn't have a break in training for racing, and they just took them all out so everybody else sort of followed suit. I advise owners to take them out, but again, it's their own choice. You can do the teeth first off, and then if they cause a problem, which they will do if they want to do anything other than slobbing around on a washing line rein, then usually get the call to come back and arrange to take them out. So,
how much do you charge to take out wolf tooth?
I charge £25 per wolf tooth.
Oh, so it's not like...
No, but then the vet has to sedate the horse.
Right. Yeah.
Okay? So I don't. You liaise with the vet. Some vets will charge X amount to take them out.
Is that
so
because you said it was very expensive to take a tooth out? Is that because the wolf tooth out?
They're very easy.
Yeah.
Within 5 minutes, you can take them out. Do you know what I mean? They're not all. They don't all come through the gum. You can have blind or unerupted wolf teeth, and they can be displaced. So instead of actually coming down, this one hasn't got any. Instead of actually going down like that, like a little peg, if you like, They actually go along and under the skin. Yeah? Sometimes they're quite difficult to find, but again, you might not think that they've got any, but if somebody that knows what they're feeling for, if they find one under the skin, again, they're worse because they're going to hit a bit more, yeah, because they're away from that too. So again, doing blind wolf teeth, vet needs to be on board. Dentists aren't allowed to cut anything. Yeah, it's classed as a surgical procedure, so it's Veterinary Surgeons Act. So the vet needs to elevate or cut the gum, and then you go in and you find the wolf tooth. So it's easy to do a nice neat little cut. I don't know if any of you have seen castration being done, they don't stitch it. So, and it will close, yeah, and it'll heal in a nice way. If you're going in, prodding around over the top of the tooth with something like that and basically hole punching a section of flesh out, you're going to leave a weak point wherever it is, yeah. So if you just get the vet to make a nice little cut straight across it, it'll mouth heal really quickly. Within 2 days, it'll be virtually won't be able to see where it's been, rather than leave something with a big gaping hole. Any questions so far? No? Anything else you're going to cover on the training? Do you want to do the training qualifications?
Yes, that would be really useful. I see you've got. Did you talk about? You've talked about his molars and his premolars.
Yeah.
Yeah, that's great. Yes, qualifications would be really useful.
Okay. There's different ways to qualify. People used to go over to America and take courses over there. That's done on how many hours you do. So 500 hours, I think it is actually qualified over there. That's fine training over there, but when you come back to the UK, you're still expected to sit the BETA exam to show that you've done the training. It's not a recognised sort of qualification. There used to be Hartbury that used to do an equine dental science degree, which was 3 years honours. They don't actually do that anymore because they struggle to get somebody to actually teach the actual dentistry. What they do now at Plumpton College, which I think is in Sussex, they do from September to February, I believe, they do all the classroom work, and then anybody that wants to do that course, then they're expected to go and get an apprenticeship with somebody that's trained under the system and do a 2 or 3 year apprenticeship, however long it takes you to basically qualify and do the classroom work. There's 3 or 4 different exams to do within the BETA system. There's some, I've bought some papers along which are sort of like, one is multiple choice. Multiple choice is easy as long as you know the answer. Do you know what I mean? You might think, oh, that's dead easy. That forms part of it to go to Bristol and do that one. You also then get given a head, but unlike Horace, it's still got everything on it, and you're expected to chart what you find in there, how you would do the teeth, do a plan of action, tell them what you found in it, and then that's like once you've done that, then you can carry on to do like the next exam. You have to do a 2-day course in Birmingham, which is like theory. So you have to sit there listening to vets and everything lecture about health and safety and laws, what you can and can't do, and then they'll show you different slides and bits, but it's compulsory to go on this before you can go on to do any of the exams. Once you've done your training, some people learn quicker than others, some are more confident than others. You can become student members of the British Association of Equine Dental Technicians when you've done so many of the courses. They run like CPD days, so you have people, vets and dentists that have already trained that give up their time free. The courses are all around the country. It's generally £50 to £75 a day to go and train with them. You'll come away, they'll assess your work and tell you what you need to do, how much you need to improve, where to improve, safe practices, stuff like that. And then you go off, when you're deemed ready, you've got to do 400 case studies. So your normal, as in like books of these, of ordinary stuff, ordinary work. And then you have to do, I think it's 50 now, of advanced cases which are sedation things. So for tooth removal, wolf tooth removal, corrective things like wave mouths or overgrowths, hooks and things like that. Not just sedate it because it's a pain in the backside and it was a damn bit easier for me and the mouth was routine. They want to see it signed off by a vet to say why you felt it was an advanced case. Yeah. All that has to get sent into Beaver, which is down in Cambridge, and they sit and go through all your sheets, and basically they'll decide if they think you've reached the level with what they've presented with your CPD days, your insurance. You have to do so many training days with either a vet or a dentist that specialises, you know what I mean, in actual dentistry, that's already passed all the exams. I think what else you need to do.
So what do you have to do before you can start your training?
Before you start your training, basically you would approach somebody that's already qualified or in the processes of being qualified to tag along, go with them, learn your horse handling skills. Yeah, they will teach you first of all safe practice with your horse handling, how to examine the horse, how to put the gag on, before you sort of start. Yeah, what clothes you need to wear, and then they will teach you how to hand rasp first as a starting point. So you've got a basic, and they'll teach you the basic anatomy until you get into like your classrooms if you're going to the colleges or whatever. So you learn how to hand rasp. You won't be allowed to take anything out or do anything other than that. Yeah, it takes a while to actually get it in. When you first put them, you think, oh, there's my teeth in here somewhere, but you can't see the angle. You've got to learn what the angle of that head is on there to where the teeth are. You've got to make sure as you're pulling back, you're not catching soft tissue, tongue, palate, whatever like that. So it does take a little bit of skill to actually learn it, and then you'll actually learn about the mouth, different like displacements of teeth. And I've given Sue like PowerPoint presentation, so I think at some point you might sort of I've put together. I didn't know if we were doing classroom and or just teeth. So, but yeah, it's apprenticeship now is really the way to go. If you're guaranteed then to have correct training. You can go on some of these courses without actually sort of being a dentist. Anybody, unfortunately, can set up and buy the gear and go, well, today this is what I'm going to be. So it's up to you to ask where they're trained, who they're trained with, are they insured, ask to see their insurance. There's only a few companies that actually insures. So it's okay saying, oh, it'll be fine. It won't be fine when something goes wrong. When the horse is broken away, if it's, you've seen people doing things in the middle of fields, well, if that horse decides to run, you are not going to keep up, you are not going to catch it. You try stopping a horse if it's got a gag on with its mouth wide open. It's not funny. You just do it in a safe environment, yeah. Standings like this, a crew, anything where it's got a bit of space to move around so you can move out of its way if it needs be. But you don't do them outdoors.
So it's not illegal for anybody to take a rasp and do a horse's teeth?
Unfortunately not. They're legislating for it at the minute.
Right.
So going through the legislations, putting it forward, and Beaver's sort of on board with it. We've got asked to compile a list and send a list in of people that are doing what they call category 1 stuff, whether they're trained, certified by American training, or whether they've just decided to do it themselves. And over the UK there's over 200 people that are doing category 1 stuff without any training or qualifications, which is quite scary.
So the qualification is an equine dental technician. And is that the only qualification, or is there a hierarchy of?
There's a hierarchy. There's category 1, category 2. Anything category 3 or above there's 3 and 4. That is just vets.
Right.
Us as dentists will never be allowed to do that. But you should be able to look in a